Hi, James. Thanks so
Hi,
much
Robin.
for welcoming me to the clinic.
Good to have you here finally.
Yeah, well, I was thinking on the way in how great it is actually to be coming in for an in-person interview. Nearly everything happens on Zoom these days, which is great. I can talk to people wherever they are, but there's nothing like an in-person. So really nice to be doing this. You've been here at Sanctura since the autumn, a new arrival in London, and but you've been operating in South Africa for, I think, 15 years. Is
Yeah.
that right? Yeah. So, what was it that made you thinking of upping sticks and setting out on a journey
Yes,
to the north?
it's a good question, and the north can be quite daunting for us down in Cape Town. As the clinic was evolving in Cape Town over the years, we were seeing an increasing amount of international patients coming through, and the kind of environment in London, doing some of the talks and lecturing around, I was really attracted to some of the clinics that we started working at. And I found myself on Harley Street seeing quite a few patients. And the one thing that I found different in the UK that was unexpected was we can prescribe protocols and patients are asking questions around treatments that they've heard about, but they don't have access to it.
Right.
And when we do find different places, they're having to travel between 5 or 6 different clinics. And so I saw a real need.
Yeah, I call it sort of DIY integrative medicine, where you have to be your own boss and put it together, program yourself, and move around from one place to another. Yeah, it's unfortunate,
Yeah.
and of course, it's the best we can do, but actually, it's not as good as having stuff under one roof with one eye on everything that's going on.
I mean, supporting agency and being captain of the ship is certainly a principle we promote, but having to manage a fleet of ships while you have cancer is tricky, and
Yeah,
a little more simple
definitely
it can
is.
be.
Yeah, well, in terms of integrative medicine, as you've noticed, there's not enough here, basically. I call us backward Britain. And so more is always great. Do you feel you brought something new here? You've already mentioned one thing, there was single roof. Anything else that you brought here that we didn't already have?
I think maybe one of the strongest contributions before we get to new would be another cornerstone in UK for an evolving medicine that is truly representative of integrative. So there's what Sanctura stands for and what we've wanted to build is not being opposed to conventional oncology,
Right.
actually quite welcoming it and making it more accessible in some cases and helping with side effects and allowing the journey to be more resilient and better quality of life on it. And then giving a real humble understanding that we don't have all the answers. And there's a huge amount of complementary and sometimes labeled as alternative medicines. And patients need some assistance navigating through that. And I think that bringing something relatively new where, again, under one roof is treatments, but the concept of integrating all of those and putting the patient first is something that is another cornerstone laid in UK integrative oncology, and definitely something more nuanced. And then, of course, the hyperthermia treatments that have been difficult to access in the UK is good. Some of our unique protocols we've developed over 15 years. In Cape Town, we have a little bit more, shall we say, lax systems that can allow us to really pioneer evidence-based medicine and include a lot of different treatments. And what's been so wonderful is distilling 15 years of work and bringing the very best of what we found to UK. And it fits in perfectly with evidence-based integration. And there's certainly some new protocols and treatments we're offering.
Well, I want to talk to you about all of those in a minute. Great. So the other thing I'd like to just know a bit more about is that obviously the sort of backwardness in Britain is due to long-standing antipathy between conventional medicine and everybody else. Yeah. So do you feel you're going to be able to contribute in some way to building bridges?
I think that the power is being given more to the people, the patients, than to the medical fraternity who is stuck in backward thinking in some aspects. And it's hard to progress in medicine with safety and the way trials are done, and even just with the economics of medicine, having so many sick cancer patients. But the more empowered patients become, the more supportive oncologists become to their journey. And in that way, I'm finding bridges being built around the patient, not between practitioners.
Right.
And I think therein lies the possibility.
Well, that's very good because we are talking about patient-centered medicine here, so that's a good development. Yeah, excellent. So Yeah, maybe we go on and talk a little bit about the therapies you're actually offering here. They're wide-ranging, I can tell. And maybe we just start at the physical end and move right through to the less tangible offerings.
Starting with the physical, being under one roof, having a place that can do, where appropriate, high dose vitamin C alongside hyperthermia, like some of those trials with lung cancers, or we know pancreatic cancer and chemotherapy, vitamin C has been shown to really improve survival and outcomes. And so responsibly doing high dose vitamin C with good minerals and electrolytes to balance osmolarity, like really good medicine from a vitamin C perspective, is good integrative support. And they're not having to go to another clinic. They might have a hyperthermia session during the vitamin C. They might be able to go for some counseling on neurofeedback. And so in one day, they're able to do those treatments. We've got a fancy hyperbaric oxygen that goes to 2.0 ATA.
Right.
And again, not positioned as treating cancer, but certainly supporting patients feeling better, recovering from surgery, assisting with those deep pockets of hypoxic tumor microenvironments. So the benefit of supporting the terrain, supporting the person, and having it under one roof, I'd say high dose vitamin C, the hyperbaric oxygen, some good botanical isolates that we know modulate immune systems and can reduce inflammation. I know paclitaxel as a chemotherapy combined with curcumin, for example. There's some really, really good studies out there. And so there's enough evidence to support that those treatments, especially if it's not taking away from quality of life where they're having to travel between many different clinics, is advantageous. The biggest game changer for us, or for what I've seen clinically, has been the electrohypothermia machine. So it's a EHY 2030 from Hungary, very expensive machine, unfortunately, but very sophisticated. And it sends a radio frequency field through certain aspects of the body that are able to heat up tumor cells selectively. That's because of the nuclear ratio to cytoplasm and the changes in the cell membrane and various other tumor activities. Much like a PET CT scan can detect activity, this sort of hones in on cancer cells. And when you heat up a cancer cell, you're dilating blood vessels, more perfusion, more oxygen. We know these tumors can be rubbery and cold. And you get more fever response, heat shock proteins, the right kind of interleukins, you get dendritic cell activation. And all of these therapies that I see showing a lot of success in research lately are actually pointing towards activity inside the tumor microenvironment. And if we can initiate a person's fever response within the tumor, it just makes so much sense that all of these things the body knows how to do and it activates. The research is showing potentially increased chemoperfusion, more oxygenations or radiosensitization, but most of all, better quality of life, less inflammation, and more malleable, less hospitable tumors. So since we've been doing that, and since we've been allowing or working closely with oncology clinics, patients would go for chemo and immediately come here. If they're getting at-home chemo, or if they're getting different infusions around the corner, or even sometimes Lloyd's at-home pharmacy gives chemo at the patient's residence. If they're traveling from overseas, they might say their residence is here. We had just yesterday, we had someone who flew in from Netherlands, and they sitting down, they're getting their chemo from Lloyd's. They've got auricular acupuncture. They've got the Hylotherm cooling device for their scalp and the peripheral neuropathy. We let them do that and then step back. Once the chemo part is finished, we come in, take them through to one of the treatments like hyperthermia. They heat up the tumor. There's more chemosensitivity. Mixing sugar in cold water versus hot water, there's more dispersion or salt. And so, so we've been seeing really good results. And then the patient might, once the chemo is washed out, we don't want to do vitamin C or any of the nutrient drips close to the chemo. So maybe 3 days later, they would come back, have hyperbaric oxygen, have a really good nutrient infusion, and maybe hyperbaric oxygen again, heat up that tumor again, prevent some of the repair mechanisms, stimulate that immune response. And one of the things that I like, especially with the nurses here that have been so well trained, many of them oncology nurses too, is the detail to the blood work that we do initially, and then the tracking of any deficiencies. So I don't like giving lots of multivitamins as a naturopath, which is how I practice in UK. I don't like giving lots of supplements and vitamins just as a blanket approach. We like to see which deficiencies are present in patients and what we might need support or which things might be low. So very personalized, precise, And maybe to reiterate that point, certainly we don't give chemotherapy as a clinic, but we allow chemo at-home services to come through. We work very closely with a private oncology clinic, and we've started working very closely with a few of the NHS practices that know what we do in the patients. They even adjust their chemotherapy time to early in the morning.
That's very exciting to hear, because that kind of collaboration, just didn't happen. So yeah, that's very interesting. So there's clearly some recognition that you're doing something to help here, which is, the total frustration of knowing how much you can help patients, but a complete lack of recognition that there is anything that could help them. It's been totally frustrating. What you're saying about hypothermia, it's, got a long tradition, it's a long history. It's kind of well known, well established, but you've described a kind of latest tech version of hypothermia. It's something that works in so many different ways, and that's why it's exciting. As you say, it's kind of got this fever element about it, which has been known about cancer, again, for a long time. But it's doing so much to support your own system to do the job. So it's a brilliant treatment. And I notice you're giving it right there with the chemo. It's not like, belate or anything, but it's definitely something you're giving to support the chemotherapy treatment that they're having.
Absolutely, and that's what the studies are showing. I think if you look at how long the chemotherapy might be within the body that the oncology team is taking care of, when the person's coming through having received treatment, they're still under active treatment with the drug in their body. And so adding something as innocuous as focused locoregional hypothermia, there's benefit to that. I just want to pick up on the one word you use, supporting the body, which I really like, and maybe going back to the narrative around how do we see more integration between the specialities from integrative medicine to conventional oncology. It's around the positioning of this is supportive to what conventional is doing. And this is supportive to what the patient's wanting to achieve, quality of life, what the patient's wanting to research regarding different types of treatments. And I think respecting and not opposing traditional targeted immunotherapy, chemo, radiation, stereotactic, TACE, all of the different treatments that are wonderful out there, has maybe allowed a more gentle entry, and having the patients more relaxed and not so distressed around moving and having to choose between multiple clinics, has allowed them to go in looking better, feeling better, and getting good responses. There's been a few oncology remarks saying, well, we think maybe the clinic you're going to has something to do with what we're seeing.
Right.
And that's a start.
That's definitely a start. Well, obviously this gives you the feel of coming somewhere that's established, that has skills, knowledge, all the rest of it to bring to the table. But interesting, just coming back to what you were saying about the words supportive, naturopathic medicine, well, that's what it is, isn't it?
Yeah.
Basically, that's how it actually sees restoring people to health, is supporting them to become well again. Now, treatment in oncology is kind of active intervention. That's what's going on there. It's different, isn't it?
Yeah.
But it also has, it produces side effects and things that produce a further need for support. So you've not just got support needed for the disease, but also for all the side effects. So, it's kind of complete common sense. But unfortunately, that doesn't cut much ice, generally, the common sense side. But the two together is such a magic combination. And you're right, that not demonizing either side and just saying, well, what has both sides got to offer? Well, that is patient-centered medicine, because the patient is standing in the middle, looking around at what could help them stay well, stay alive. And of course, they shouldn't have to just look one way or the other.
No.
They should be able to look all around and choose what they need.
Such a difference between surviving and thriving. Cancer patients on chemo can look healthy and well. That's quite something. Robin, just on that element of how we're treating the whole person and not just the disease. So from naturopathy, absolutely, we're looking at the elements around that. But one of the analogies that's maybe worth sharing on this podcast, which I use with patients very regularly, I'm more into rugby, being back from South Africa, but rugby and soccer's big here. If you've got a soccer team, you need good strikers in the front who can score goals. If you don't have a striker, you can't score goals and win a match. But you can't have strikers without good midfield, good defenders, and a really good goalkeeper. And so a lot of patients are going out there with excellent midfielders and defenders, and they're not scoring any goals or winning any matches. Others are going out there with strikers who might score a few goals, kill a few tumors here and there, but their body collapses. And so it really isn't just a concept of different modalities. I think it's an essential part of one's whole infrastructure and team that's going to win matches and heal.
Yeah, it makes complete sense. The other aspect of integrative medicine is it does look at the whole person as well. It looks at all the aspects. Perhaps you want to say a little bit about your thinking on the psychological, emotional, spiritual side of things.
I was always fascinated when, so medically trained back in South Africa, naturopath in UK, but during the medical training, they would say, this treatment would have this much percentage effect. And if you added 2 treatments together, you would increase the effect. And I'd say, well, what's the placebo effect? They go, well, placebo effect is when people believe in something, but they don't take anything. It's nonsense, but it improves them by 30 to 40%. So what happens if you add placebo onto the drugs you're taking? Surely you can double what the drug's doing. And, there's some muttering and there's some really interesting research around that now too. And when we have a patient who comes in, it's like clockwork. They come in, they're afraid, they're hesitant to do chemotherapy, they feel like they're torn between 2 worlds. Mm-hmm. The minute they get that chemotherapy, their side effects are worse. They're trying to have an intense diet that is starving them of nutrients, and they're trying to treat cancer to get some certainty in a world of uncertainty, and they're grasping at everything. And that person has a completely dysregulated immune system, dysregulated nervous system. Their gut microbiome has nothing to do with bacteria or antibiotics. It has to do with the whole stress, humoral and immune response relating to that vagus nerve and how the gut is going to function. So your gut microbiome is completely out. That stressed, asphyxiated, distressed state is a tumor promoting state. And when someone comes in confident and says, I want that chemo because that's what the oncologist says it's going to work, I'm going to choose this to help me out, and I'm going to nourish my body, and I'm going to look deeper, what's knocked at the door is an opportunity for healing. And you see patients do that from the start. Their course of treatment is so profoundly different.
Very understandably so. I mean, the first description was of a fear-based response, basically, and you're not in the right place to make good decisions when you're terrified. Basically, you're going to do knee-jerk responses. You're not really in yourself. You're not really tuned into your needs or anything else. So, yeah, I absolutely agree with you. And these things, as we mentioned earlier on, they're kind of moving from being seen as add-ons on the side, or the psychological and emotional stuff, nice to haves, to actually being foundational to a good recovery. But without those in place, you're maybe heading for disaster. So I really like that change of emphasis, because with it comes in the idea that a big part of medicine is all those things. It's not just about the practical stuff.
If we can spend a little more time on this, there's some discussion points I'd like to unpack. Just I'm enjoying the discussion so much. Again, it's not one or the other. So the more one focuses on the human experience we have, both through wellness and disease, it shapes our entire psychoneuroimmunology, like you say, and the change between hope, which is a choice, not a statistic, and between a fear-based response or an empowered agency, positive outlook. We know how much that influences. The more people do work on themselves from that aspect, it's almost the more or reduced the practicalities of treatment become, but yet they are so instrumental. It's like having a bolt that's not tightened on a car, it's going to come loose. And so those practicalities, I always use the example of if you've broken a bone and it's sticking out your skin, no matter how much emotional processing you do and how many herbal supplements you take, you need that bone fixed and you need to look after it and prevent infection. By the time cancer cells have formed and have created their own microenvironment of stubbornness and beautifully engineered growth patterns, you need hard intervention from a physical 3D biochemical interface. And so that medicine is a bridge to a healthier state, but the responsibility lies with how do I change what initially was the environment that allowed cancer to grow. I've noticed themes with each cancer, Robin, which is very, very fascinating.
Okay.
Every hand on heart, every prostate cancer has exactly the same personality, every breast cancer, every colorectal cancer, and not saying that causes the cancer.
No.
Just a trend that I notice.
And when you say exactly the same personality, what kind of traits are you talking about?
A breast cancer patient, often very nice, likes to please, can be very empowered, but when overpowered by even medical authority, becomes disempowered, shall we say. And the phrase that I love when a breast cancer patient sits opposite me and says, I've realized making myself smaller so that other people can be happier is not the definition of kindness. And any breast cancer patient listening will really resonate with that. That's a theme underlying. There tends to be a history of some punitive parenting from the one side, and the other parent being quite soft and open-hearted, but a bit overall. So there's these patterns that emerge. Prostate cancer is example. I really enjoy working with prostate cancer. We know that they're going to have a good consult, but they want a form of exactly what's going to happen.
Right.
And we can time it. 36 hours to 48 hours will be the response every single time. Their personality is categorized and to the point, and their gender, and that's what they need in their system. Colorectal cancer patients, I mean, just now that we're on the theme, have a very driven, very type A, often quite successful, able to make choices for those around them very quickly. But when it comes to making choices for their own health, they find it incredibly difficult.
How interesting.
And to make themselves the most important person in the room is a real challenge for them. So anyway, I could talk lots about
Very
that.
interesting. Well, you're not the first person to speak about that kind of thing, but it's just interesting you're passing on your experience of actually meeting people. It's not just a book you wrote. Yeah. So really interesting stuff, and it does all point towards how important and key some of these things are in having got people to the situation they're in, and therefore what they need to address in order to get out.
Yeah. What's that one beautiful book, The Body Keeps the Score?
Yeah.
And where the cancer grows, there's often an emotional conglomerate that is well worth releasing. And just to re-emphasize, seeing so many patients go down the path of finding not just general psychological wounding, but related emotional conglomerates that are stuck. We say cancer grows, but you are not. So when we return to the parts of our body with a psyche that can change the meaning of the experience one's had, we can free that energetic pattern. But that doesn't mean the cancer goes away. And that's where the integration comes in.
Yeah.
Eventually.
Yeah. Well, it certainly opens a lot of doors. I've heard it from so many people, either practitioners or people with cancer themselves, that it's the stone they hadn't lifted, and then it made such a difference when they did. So, fascinating. Well, what an interesting talk, James. Thank you very much.
Thank you, Robin.
And
talk for days. I like this.
And absolutely, and thanks for inviting me up here.